Hey everybody, this is John Oxley from Huntington Physical Therapy, doing my tip of the week. And today what we're going to talk about is balance and falls. What's kind of made me think about this is I've had several patients who have talked to me recently about their not only elderly parents, but sort of their parents that are getting up into their 60s, 70s, 80s, talking about using canes and walkers and talking about falls. And it seems like a lot of people have questions that aren't really getting answered. They have concerns about their parents falling because then that makes them more of a risk for certainly mortality, but also a risk for just becoming, and I don't want to necessarily say a burden, but a problem for the family to manage, because then they can no longer live on their own. So what I wanted to talk about was how we can address that as physical therapists, how we can be an asset to the children and loved ones of some of these older people that seem to be having some weakness and falls. First of all, what people need to understand is that there are balance scales or balance tests, formal tests that have been created that we can use to determine how people's balance is and what areas they need to improve. So it's not us just taking a subjective look at a patient and saying, oh yeah, their balance is off. We actually have tests that we use, formal tests that can tell us and also prove to the patient, see, you're having some trouble with this stuff. The other thing that we can recommend as a result of these tests is either conditioning or some strengthening for certain areas, proprioceptive work, which means basically understanding where your joints are in space, but also we can recommend assistive devices, canes, walkers, things like that. And usually when it comes from a physical therapist and a professional that has done a formal test on these people, they tend to be a little bit more open to the idea, and we can give them a little better idea of what the effects of falling can be, because as most people know, they can be pretty catastrophic, especially falls and hip fractures in elderly people. It can really increase their mortality rate. So in the end, what I want people to understand is that we're here to help, even if it's just going to be a one-time evaluation for your loved one, so that we can look at them, do a balance test, assess where they're having some issues, and give a plan to work on, or it's going to be kind of a longer, more protracted treatment plan. That's what we're here to do, and that's what we're trained to do. So let us kind of help your family and be an asset to your family to try and get some of these loved ones doing some of the things that you might think that they need to do or you want them to do that they're just not really prepared to do. Because after all, advising other family members can be very difficult, but when that information comes from a medical professional that's trained to do these type things, they tend to respond a little bit better. So hopefully that gives people a little bit of insight into how we can help with their loved ones and their family members, decreasing the incidence of falls and improving balance and just taking some of the stress off of the family members that are worried about their loved ones. Thanks for listening, and talk to you again soon.